What if Alzheimer's starts in your 20s, long before any memory fades? Today, we're exploring how the disease begins, the early warning signs, what's genuinely promising versus still experimental, why women face higher risk, and the lifestyle habits with the strongest scientific backing. They call it the long goodbye. Alzheimer's can strip away memory and dignity until only the body remains and the stories disappear. It's not rare. In the UK, dementia, including Alzheimer's, is now the leading cause of death and the top cause for women. In Australia, more than 400,000 people live with dementia, and it's among the nation's leading causes of death. Also #1 for women in recent years. Behind every statistic is a face, a family, a story interrupted too soon. Alzheimer's is the most common form of dementia. At its core, it's a breakdown in how brain cells communicate and clean themselves. Two proteins define the process: amyloid plaques, sticky clumps that build up outside neurons, and tau tangles, twisted fibers inside them. These changes can begin 20 years or more before symptoms appear, like silent rust forming long before a machine fails. The 10 early warning signs. These signs are often brushed off as just getting older. 1. Memory loss that disrupts daily life. 2. Problems planning or solving problems. 3. Trouble completing familiar tasks. 4. Confusion with time or place. 5. Visual spatial difficulties. 6. Word-finding problems. 7. Misplacing items and being unable to retrace steps. 8. Poor judgment. 9. Withdrawal from work or social activities. 10. Changes in mood or personality. Early on, recent memories fade first. You might tell the same story or ask the same question within hours, while older memories remain intact. Behaviour and late-stage symptoms. As the disease progresses, new symptoms often appear: hallucinations, delusions, agitation, anxiety. These changes can be deeply distressing for families and are a common reason people enter residential care. In later stages, eating and drinking become difficult, weight drops, and continence and speech are lost. Eventually, the brain can no longer coordinate essential functions, and infections such as aspiration pneumonia become common. Alzheimer's is ultimately fatal, but that doesn't mean it's untreatable in every stage. You may have seen dramatic stories online. Patients describing fog clearing within minutes after an injection called Perispinal Etanercept. It's an anti-inflammatory drug originally used for arthritis, injected near the spine. So far, though, robust clinical evidence is lacking. The treatment remains off-label and experimental. There are powerful anecdotes, but no large placebo-controlled studies confirming long-term benefits. It's fair to describe it as promising but unproven. And any patient stories should be treated as individual experiences, not typical outcomes. About 2/3 of people with Alzheimer's are women. Research shows women often have a higher tau burden, and the APOE4 gene, the most studied genetic risk factor, tends to have a stronger effect in women than men. Think of APOE4 like a volume knob for risk. One copy roughly doubles or triples your risk. 2 copies can raise it 10-fold or more. But exact numbers vary by age, ancestry, and sex. Even diagnosis can be harder for women. They tend to have stronger verbal memory, which can mask early decline on standard tests. And while the new antibody drug Lecanemab, Leqembi, modestly slows decline, early data suggest women may respond differently, though not necessarily worse. Some researchers describe Alzheimer's as a network insufficiency, not one broken part, but an entire system under strain. Dr. Dale Bredesen popularized this framework, focusing on three areas: energetics, inflammation, and toxins. Many ideas in this space overlap with mainstream prevention: improving sleep, treating sleep apnea, exercising, eating better, and managing metabolic health. Claims of full reversal, however, remain unproven in large controlled trials. These are best viewed as adjunctive and experimental, not established therapy. The brain runs on glucose and ketones. Insulin resistance and sleep apnea both impair that energy supply and damage memory regions like the hippocampus. The strongest evidence supports 7-8 hours of sleep, treating sleep apnea, regular physical activity, and diets that improve insulin sensitivity. Supplements like creatine or NMN remain under investigation, with limited human data. Chronic inflammation is linked to cognitive decline. Treat infections when medically indicated, but there's no proof that treating infections fixes cognition. Turmeric, curcumin, shows mixed results in human studies. Interesting, not conclusive. Toxins. Pollution and heavy metals are genuine risk factors. The popular idea that we eat 5 grams of microplastics a week is likely exaggerated. Real intake is uncertain. Frequent sauna use has been linked observationally to lower dementia risk. But again, that's correlation, not cure. Think of it as a healthy routine, not a treatment. Exercise and movement. Regular activity is one of the most powerful tools for protecting the brain. Large studies show people who move more have a lower risk of cognitive decline and many chronic diseases. You don't need to chase exact step counts, just move more than you do now. Mental stimulation, keep learning, play chess, learn a language, pick up an instrument, or solve puzzles. Each builds cognitive reserve, the brain's ability to find new routes when old ones fail. Sleep and stress. Sleep is the brain's maintenance shift. During deep rest, the glymphatic system clears waste proteins like amyloid and tau. Aim for 7 to 8 hours of quality sleep and manage chronic stress, which can shrink key brain regions. Diet. A Mediterranean-style diet, rich in vegetables, fruits, olive oil, fish, nuts and legumes, is consistently linked to healthier aging and slower cognitive decline. Use meat more sparingly. Social connection. Stay close to people. Friendships and family ties aren't luxuries. They're protective networks for your brain. Diagnosis, reversible causes and stigma. If you're forgetting recent conversations, missing appointments, or losing track mid-sentence, get evaluated. Routine screening for everyone isn't needed, but early assessment matters when symptoms appear. New blood tests that measure Alzheimer's-related proteins can help support diagnosis alongside clinical exams and imaging. But they aren't standalone tools. Always rule out reversible causes. Vitamin B12 deficiency, depression, thyroid problems, sleep apnea, poorly controlled diabetes, medication side effects, normal pressure hydrocephalus, or subdural hematoma. And don't underestimate stigma. It silences people and delays care. A discreet, compassionate visit to a specialist can lead to earlier help, better planning, and sometimes real improvement in quality of life. Final recap. We've covered how Alzheimer's begins, the E, why women face unique risks, what's proven versus experimental, and the habits that truly protect the brain. Move more, sleep better, eat mindfully, stay socially connected, and keep learning. Start with one small change this week. It's how prevention begins. If this video helped you, subscribe for more science-backed, human-centered insights on brain health and longevity. Because even in the face of Alzheimer's, there is always hope.